If a parent is concerned about these diagnoses, and let's say they haven't actually gotten the diagnosis yet, what should they be looking out for? What are ways that it affects their day-to-day learning?
Great question. So many ways, but I think...
Yes, let's go break it down.
I think what we see a lot of times is resistance to schooling,
Yes.
Creating smoke and mirrors, distractions, really anything.
Oh my gosh, my daughter is so good at that. It is
Yes.
it's like, wait a second, is it my ADHD that now I've forgotten what you were supposed to do, which is math? Like,
Yes,
okay.
the art of distraction is huge.
Yes, okay,
Yes.
all right, art of distraction, check, next.
It can really look like disliking, dreading school. One of my students with a math learning difference used an acronym for math, MATH, mental abuse towards humans. And it was just dreading every day going into school, going to math. We tend to see some behavior challenges pop up in the classroom too, where students, the demands might exceed the capacities. And in order to cover for that, they're socializing with friends or playing the class clown.
Yes, that totally makes sense. My daughter will say, math makes my brain hurt. The other subjects don't make my brain hurt. But I'm going to have to tell her about the acronym math.
Yes.
She will probably wholeheartedly agree. She also then says IXL is like the worst thing for these kids as well. And that we could probably do a whole podcast about all those different types of learning strategies. But when you talk about all the different types, I mean, you're seeing kids with ADHD and dyslexia and math learning differences. It's such a lot of variation and a lot of variability. How is it that you can help? You just have to really focus in on a child, or there's some commonalities that can assist with all of them?
Honestly, every student is so unique. So I might use some similar strategies, but what that looks like for each student is going to be so different because their interests differ, their needs differ. I like to think performance in school like an iceberg, where at the very tip of the iceberg on top, what we see is their grades, their ability to do the work, do their math, their English, their history, also the social skills or the behavior that we can visually assess. But underneath that is all of these underlying skills, the processing skills, their executive functioning skills. Each of those individual variables creates that student that we see up top. So
I like that iceberg analogy.
Yeah.
That's really good because then you can apply it. I mean, a lot of these learning differences, I would imagine, run in families. At least they do in our family, but they are very unique in my children. They don't have the same learning or processing issues. So that's such a great way to kind of think about it in general. As a parent of two kids that have learning differences, it can feel really overwhelming, right? And it can feel also very vague, like learning differences, and we're shying away from the word disability, right? We don't use that anymore. What are the most common challenges you see in your practice, whether, in that discussion?
Yeah. I would say the executive functioning piece is huge because this is one that we don't explicitly teach in schools.
Right.
And yet it's kind of just implied that students will pick it up. And oftentimes when we do have students with learning differences, particularly an ADHD profile, these skills are just not so intuitive. The planning, prioritizing, organizing comes with a lot of challenges for these students. And so that's probably one that I see most often. And it's also one that has the greatest gains when we can build up skills in these areas, because executive functioning will persist for the rest of your life, not just in school settings.
And I found, this is what I think makes it difficult. So I don't know how you approach this clinically, but what works for me in terms of my executive function, all right, I like to use this kind of planner or this online resource. Doesn't work for one of my children. He wants to do something else. Whereas my daughter, like sometimes her executive function is like so good that it can mask some of the other things. And so how do you, there's just so many different ways for planning. Is it just try it out, see what works, or?
There's a little trial and error involved for sure. And what you mentioned is something that I hear so often from parents when they find me, because they think, well, I've tried exactly what works for me. Why isn't it working for my child?
No, I kept trying to sit down with my oldest son who has inattentive ADHD. I'm like, okay, so we got to create routines and we've got to create habits, and you need a morning routine, and you need because he would never check emails, literally never check emails and miss all these really important things. And he would forget to turn in his homework. All right, so now every day you've got to do this and you've got to have your checklist. And he just never did it. Absolutely never did it. So that's something common that you
Absolutely.
hear.
Yes. And it really really comes down to finding what's going to feel intuitive for this specific child, for this student, and then having a lot of consistency and support and putting it into practice. Because sometimes they can be really excited by an idea at the start, and then that excitement tends to fade as they realize, oh, we actually have to do it every day. I'm like feeling tired today. I don't want to do my homework today. But that consistency, that encouragement, and then when they start to see the gains in the school setting, that's really what sets our momentum going.
And then so you get that positive
reinforcement. Absolutely.
And that feedback loop, which hopefully then is sustainable, self-sustaining, right? Okay, now for parents who don't necessarily know, and I think this is probably a lot of like misconceptions and myths, how is educational therapy different than academic coaching or tutoring, right? Getting a tutor for the dyslexia. How is what you do different?
Great question, and a very common one that I get from parents. Yeah. I would say that academic coaching or tutoring on the one hand is really focused on the content, the now, the how do I best prepare for this test in this subject. And that is absolutely lovely to get students through this course or this year. But what educational therapy focuses on is the skills, those underlying skills, the things underneath the iceberg, and really honing those skills in those areas so that they're able to process and stay organized, stay prepared for their classes. It's building up these skills so that they ultimately won't need a coach or a partner or a tutor in the future because they have the inherent tools and resources to be successful in these school settings.
It sounds like a pipe dream for my oldest. I love him. He's so smart. But it can feel like that's just a mountain that you might not even be able to see over it. When you're helping these kids and you're really like just chipping away and getting to this place where they can be self-sustaining, I mean, especially for kids with ADHD or those kind of issues, there's obviously got to be a maturity aspect to it, right? They're a little bit delayed socially, emotionally.
Right.
Is this something that usually I wouldn't imagine all of a sudden your executive function is going to get better at 25. If it's not good now and you don't have the foundation, it's not going to be good. But how does age or developmental milestones kind of play into everything?
It's huge. Because sometimes I will see the greatest gains, and I love to, say that it's all of the hard work that I'm doing behind the scenes, but sometimes it really is that kids have reached this huge growth period in maturity, and oftentimes really taken initiative for themselves, because so often, especially when you have a child with learning differences, parents are playing a huge role in helping them cross the finish line every single year, and they are really providing so much support from behind that sometimes students can kind of take for granted or lose sight of the fact that they're in the driver's seat, that we're providing this support, but it's really them and their buy-in to the process that moves the needle. So sometimes when I see that piece click, and that does come with age or with maturity, where students are like, I am really in control of the effort that I'm putting in right now, and that effort's going to have huge rewards later. When I see that click in, that's when I see the biggest gains, and ultimately, as you mentioned, kind of that self-sustaining piece where students can keep going despite the challenges that they're going to continue to face if they have a neurodivergent profile.
For more tips on eye health, parenting, and staying focused in a busy world, follow me on Instagram at Dr. Rupa Wong, or head to drrupawong.com. Until next time, keep your vision clear, your priorities focused, and your family thriving.